This is Case 4, presented by Group 4, the Chill Pills.
RS's father presents in the pharmacy for RS because he is experiencing a localized rash and adverse drug reaction from his sunscreen and needs a product to relieve his rash and an alternative product for sun protection. From RS's father, we learn that he is a 15-year-old male. His father reports that he has no previous medical conditions and is using no other medications. There was no assessment of caffeine, alcohol, tobacco, or social drug use made in this encounter. There was also no assessment for immunizations. RS's father reported no other alerts for RS.
In this encounter, the patient's father entered the pharmacy and said that RS developed a rash from the sunscreen that he used. The father said that the patient does not have any other allergic reactions or intolerances to medications. It appears that the father has a very trusting relationship with pharmacists because the pharmacist was quickly able to determine the likely agent which caused the adverse reaction, and the father was open to taking suggestions from the pharmacist about how to treat the rash and looked for an alternative sunscreen product. According to the patient's father, the patient is not taking any medications other than the sun protection sunscreen containing oxybenzone. His directions to apply the sunscreen is apply a thin layer topically to skin prior to sun exposure. Uh, the exact start date is not known, but it's likely that it started recently on their vacation when they were exposed to a lot of sun. It's unknown whether or not the sunscreen was effective, but the patient did develop a rash, so he will likely need a new sunscreen product.
Physical inspection of the sunscreen tube resulted in the identification of oxybenzone as the suspected causative agent of localized rash.
There are two drug therapy problems for RS. The first is an adverse drug reaction to oxybenzone in the sunscreen he used. The second drug therapy problem is that he needs additional drug therapy to treat the rash caused by the sunscreen. The goals of therapy for RS are both short-term. The first goal of therapy is to provide RS sun protection for the remainder of vacation within 2 days and without inducing an allergic reaction. The goal of his second drug therapy is to eliminate his rash completely within 1 day of pharmacological treatment.
Therapeutic options. For our first indication of sun protection, our two therapeutic options are Vanicream Broad Spectrum Topical Sunscreen SPF 50+, and Neutrogena Ultra Sheer Dry Touch Sunscreen Topical Lotion with Broad Spectrum SPF 55. We chose Vanicream Broad Spectrum Topical Sunscreen as it does not contain oxybenzone and the active ingredient that caused RS's rash. It is specific for sun protection, contains zinc oxide to assist in the relief of the rash, and is used for sensitive skin. For our second indication of an itchy rash, the two therapeutic options are hydrocortisone 1% topical cream and Benadryl 25 milligram tablets. We chose hydrocortisone 1% topical cream to relieve the patient's symptoms of an itchy rash and will not cause further skin irritation. Plan hydrocortisone cream. The patient should start a new drug therapy, hydrocortisone 1% topical cream. Instructions for use is to apply a thin film of the cream topically to the itchy rash site every 6 hours as needed. The rationale is that the patient presents with dermatitis with an itchy rash, likely from an allergic reaction to sunscreen containing oxybenzone. The hydrocortisone should relieve the patient's symptoms. This medication is not photosensitive, so the patient should not experience any further skin damage or irritation from being in the sun. Notes for the patient should begin treatment with this new medication. They should wash their skin well before applying the cream. After applying hydrocortisone cream, the patient will wait 10 minutes before applying the topical sunscreen.
We are discontinuing the sunscreen RS used previously because the patient appears to have had an adverse drug reaction. The active ingredient oxybenzone caused a localized rash on RS's arms and legs. We recommended a different product for the patient's sensitive skin. Vanicream Broad Spectrum Topical Sunscreen Lotion, SPF 50+, with titanium dioxide 5%, zinc oxide 7%, as active ingredients seem to be the best option for RS. It is a physical filter sunscreen that does not contain oxybenzone, which is an ingredient that we suspect is causing an adverse reaction of an itchy rash in patient RS. He should apply the sunscreen topically to the skin as needed 15 minutes prior to sun exposure. Some notes for the patient is that this is the start of a new drug therapy. He should reapply the sunscreen after 80 minutes of swimming or sweating, or at least every 2 hours.
Some other forms of treatment RS can utilize to maximize the benefits of his treatment plan is to patch test the new sunscreen before use to make sure there are no adverse reactions to the new product. He should also wash the affected areas well before use of any topical creams, allow it to completely dry, then use hydrocortisone topical cream first, then wait 10 minutes before applying sunscreen. He should wear clothes that minimize sun exposure to affected areas, as this can exacerbate the rash. He should also avoid using any products that contain oxybenzone, and wearing a wide brim hat outside if possible to protect the face.
We decided to schedule 2 follow-up appointments with the patient. One will be in 24 hours and the other in 48 hours. The first appointment will be to verify 2 things. First, we will want to verify that RS's original allergic reaction has not become systemic. This would be serious, and therefore we would want to catch it early. A systemic allergic reaction may be indicated by RS experiencing fever, chills, and nausea. The second verification we will make will be to evaluate if the hydrocortisone treatment is working and that RS's rash has completely subsided. By this time, he should see the redness, bumpiness, and itchiness completely gone or significantly improved. The second appointment is scheduled for 48 hours after the pharmacy visit. This will be the last day of the family vacation, and we will want to verify that the new sunscreen product was effective in protecting RS from the sun without causing another allergic reaction. We will verify that RS has no new bumpiness, hives, itchiness, or peeling, and that he has not developed a sunburn. Finally, we will want to once again verify that the initial rash has been resolved by the hydrocortisone with no other side effects, such as peeling skin, acne, or an increased blood pressure.